Here we go. Oop. Hi, everyone. Thank you so much for joining us with CMQCC's next Let's Talk Perinatal Equity webinar. Today, we are talking about enhancing equity through engagement and specific strategies for inclusive patient and community engagement. I will give us another minute or so to let people come and join the webinar. So we'll get started in just a second. Hi, everyone. Thanks for joining us. We're just letting people join the Zoom and filter in. Okay. We're really excited. This is our 6th webinar series in the Let's Talk Perinatal Equity webinar. Today, we're sharing specifics around equity through engagement and patient and community engagement. So Kendra, we can go to the next slide. Just as a reminder, if this is your first time joining us with the equity webinars, you can receive nursing contact hours. Just please fill out the evaluation you'll receive with the link in your email in the next 2 days. You need to be in attendance with the webinar for at least 50 minutes, but keep an eye on your inbox because that'll be coming to you to complete the evaluation. Next slide. A couple of housekeeping rules, as we're all sort of familiar with Zoom now at this point. You should all be muted when you've entered the Zoom webinar, but please just double check and make sure that your microphones are muted just to show some respect to our presenters today. The Q&A function will be enabled, so please put any questions you have into the webinar. We have some CMQCC folks prepared to answer them for you, provide any resources, direct you anywhere. You're welcome to use any of the slides for educational purposes, but if you add or modify any slides, just remove the CMQCC logo you see down at the bottom and add your own institution. And we are would really love some feedback or recommendations from you guys for future webinars if you have any ideas or things you'd like to hear more about. And again, you can fill that out in the evaluation via email. Next slide, Kendra. We're going to be using some different language in our CMQCC webinar, specifically today with birthing people, mother, maternal, they, them, she, her, pregnancy capable persons, to reference all people who can be pregnant or can give birth. We recognize that not everyone who gives birth or is pregnant identifies as a mother or as a woman. So we want to use these terms interchangeably to represent all people in this space. Next slide. The webinar recording and the slides will be posted to CMQCC's website in the next 2 days on cmqcc.org. So you'll have access to both of those within the next couple of days. If you or anyone else you might be interested in the webinar, want to go back and listen to the recording or take a look at the slides again to review any references or resources. Next slide. And I'm really excited to share our presenters today. We have Dr. Kendra Smith, who is our birth equity advisor with CMQCC, and Dr. Lindsay Duplessis, who is our community engagement lead. We're really excited to have them share on community engagement strategies as they are the experts in our organization. So I will hand it off to them. Dr. Smith, go ahead and take us away.
All right, thank you, Savannah, and thank you all for joining this webinar. Lindsay and I and the rest of the CMQCC team are grateful that you joined us and hope that this is a valuable use of your time. So like Savannah said, I'm Kendra Smith, and I'm joined by my colleague and partner in all things engagement, Lindsay Duplessis, who's the community engagement lead at CMQCC. I've had the privilege of serving as equity advisor to CMQCC for the last 4 years now, and it's been an honor. And to just give you a little bit about me, I've spent my career working in community and patient engagement in clinical and non-clinical settings, and I believe wholeheartedly that equitable engagement can be central to addressing the problems in health services, systemic inequities, and overall care. And so that's why I'm here. That's why we're doing this webinar. At CMQCC, we're working diligently to identify and deliver education and opportunities around providing more respectful and equity-centered obstetric care. Patient and community engagement are certainly part of that. So the objectives for today are to describe the foundational principles of community engagement, summarize the relevance of patient and community engagement in obstetric care, to demonstrate strategies for identifying community obstetric services, and develop practical strategies for enhancing patient and community engagement through partnership. So we're hosting an entire webinar about engagement because where equity and engagement meet, powerful things happen that can improve institutions, health systems, units, communities, patient outcomes, and so on. Community engagement is central to addressing the systemic inequities and structural discrimination that are entrenched in our health system. So by exposing unforeseen and unintended barriers of health through the participation and the involvement of patient and community members, we have the opportunity to positively impact the practices and the quality of care that we put forth. However, community engagement by nature is not a guaranteed tactic to increase equity, right? To actually realize the full potential of community and patient engagement, it has to be designed with equity as a leading principle. And we'll talk more about that in this webinar. So before we get into too much detail about community patient engagement, it's important that we first define what we're talking about. So let's talk first about patient engagement. Patient engagement is really the process of actively engaging patients in their healthcare. The key word there is actively, right? So at some given time, we've all been patients, right? And how passive or active we've been in our healthcare is really dependent on a lot of things. And so the art of patient engagement is really being intentional and deliberate about things about shared decision making, partnering, the patient partnering with their healthcare team, and moving up into more providing patients more opportunities to be responsive to what's happening in their care through serving as advisors and co-leading efforts through quality improvement. So if you see over to the right, there's a figure. This figure describes really 3 levels of patient engagement, right? So the first level of patient engagement is direct care, and this is probably what we're most familiar with. So the direct care is I go to the doctor, I work with my care team to address the health issues that I have and my overall well-being. How deeply we are into that or how engaged I'm into that really depends on me. It depends on the healthcare team and the overall philosophy of that hospital or that clinic around patient engagement and what standards they put forward. So at the top here, you see a continuum of engagement. So the continuum of engagement always runs from the least to the highest amount of engagement. And so it's giving us this example that at the lowest point of patient engagement, a patient receives information about a diagnosis. And that's just kind of it. They go away and do whatever they do, and are kind of more often told what to do, what medications to take. They don't ask a lot of questions. They just go with what the doctor says, right? Because have you ever talked to a family member and they say, well, the doctor told me this, and you say, well, what about this? And they say, I don't know. You always say, like, did you ask any questions or things like that? Like, that's kind of the most passive form of patient care. And if we move up to the involvement side, it's the example here is patients are asked about their preferences in their treatment plan. And the highest form of patient engagement is partnership and shared leadership, where the patient's preferences, their own research, and the clinical judgment of the care team are all factored in when making the decision about the patient's care plan. Right. So that is the direct care version of patient engagement. On the organizational level of patient engagement, this can mean a lot of things. So at the organizational level, you could be working with patients for certainly quality improvement. You could be working with patients to identify the process or opportunities to improve the build out of a new wing of a hospital, or to help improve some policy that you find problematic in your hospital or that just isn't working. So that is the organizational level of patient engagement, and it's quite important. So for example, at CMQCC, we, for the last 5 years, or about 3 or 4 years at this point, we've had a project on reducing inequities in maternal sepsis care. So we know that maternal sepsis, it doesn't happen often, but when it does happen, it is quite catastrophic for the birthing person as well as their family, and there are cases of death as well as near misses, right? And so in this project, we centered this project around patient engagement. So we have a maternal sepsis leadership board, which is basically an advisory council that is made up of public health people, nurses, public health nurses, physicians, researchers who are well versed in severe maternal infection. And at the core of this group, we have 5 patient advisors who have all experienced really catastrophic incidents of maternal sepsis. And so these patient advisors at the very onset of our project really helped guide a lot of what we did in this project in a way that would not have been possible without their voice and their experiences, without them sharing their voice and their experiences of what actually happened to them from a personal level instead of just speaking from a clinical level. Right. And so so our maternal leadership board, who's made up of all these people, including our patient advisors, have actually been quite critical to the success of this project. And a lot of what we'll do when we update, for instance, the sepsis toolkit. So there's an existing sepsis toolkit on CMQCC's website right now that we're making revisions to. And so the patient advisors have provided lots of feedback about the edits and the revisions to this toolkit that will be published. And so we wanted to make sure that we had these feedback and this information shared from our patients, and that they go into our products. So that's an example of organizational level patient engagement. On the last level of engagement is really society level engagement, which could be community level, policy level. It could be on a research level, especially if you work at a research hospital. Patients can really help with setting priorities, developing research questions, participating in PDSA cycles. They can do all of these things that can help support quality improvement. It really just depends on your organization's needs, the level of expertise, the resources, the time resources that you have to involve patient advisors. So let's move on to community engagement. So community engagement is different from patient engagement because when we talk about patient engagement, we're talking about people with lived experience with whatever it is that you're talking about. So in our, for, like I said, our project was people with lived experience with sepsis. It could be people who have been pregnant before. It could be people who've given birth via cesarean delivery. It could be people who've experienced preeclampsia. It just depends on what area or what issue you're trying to address. Community engagement is different because it is a collaborative process between an organization and a community group or multiple community groups that are impacted by each other's policies, programs, practices, governance structure, and in this case, delivery of health services. Hallmarks of community engagement are that the partnership is mutually beneficial and bidirectional. When we say community, it's important that when we say community that we're talking about who we're being precise in who we're addressing, right? So a community, we know communities are a group of people that can be living in the same place or who have a particular characteristic in common, right? So our CMQCC team is a community. My neighborhood is a community. We can also be talking about the birthing community, the L&D community. We could be talking about, Asian birthing people who experience a certain condition. It's important that when we're talking about community and patient engagement, especially when we're addressing a particular issue, if it's not broadly for everybody in the community, we should work to be precise about who we're talking about. Okay. So over to my right on this figure, it also provides some helpful information about the levels of engagement. So when we talk about engagement, you should think about it, or when you think about your level, your engagement, you should think about where do I want to have the most impact? If it's on the individual level, you're talking about patient engagement. But if you're talking interpersonal, institutional, community level, and certainly policy level, then that is community engagement. So when we talk about community engagement, there are many principles, many versions of principles of community engagement that are out there. And so I won't go through all of them, but what you need to know, and the most important thing about the principles of community engagement and certainly equitable engagement is that one, it's important that you respect and honor community voice, right? So many people who work in clinical settings are experts in their field, right? And so there's a level of expertise that you have that you went to school for, that you certainly built through your career. And sometimes it can feel uncomfortable giving lay persons a quote unquote seat at the table to provide feedback or to give information. Um, for a variety of reasons. But if you're going to do community and patient engagement, you have to value community and patient voice. And so getting to a place where you can do that is quite important. And things like careful planning and preparation, inclusion, and certainly increasing diversity in who you work with is important. Collaboration and shared purpose, being collaborative, learning how to be collaborative, and really developing a purpose of whatever it is that you're trying to do. Doing that together is critical. Openness and learning from each other are critical aspects of community engagement, and sustained engagement is certainly a foundational principle of community engagement. And when we talk about equitable engagement, we're really talking about fairness and thoughtfulness around engagement, and doing things that embrace and value the diversity of your group, and that really realize and acknowledge the role of race and power in what you're doing, right? Because we fundamentally should understand that if you're involved with patient engagement, right, there's a fundamental power imbalance between the healthcare providers and the patient advisors, right? Because there's the healthcare team has resources. They don't have to be involved. They don't have to listen. And they could have more prestige or clout in that relationship, right? So even acknowledging the power imbalances that are there, especially when it comes to gender too, and when it comes to race, is very important, as well as just societal standing. Being very hospitable to your community partners. And by hospitable, it really means listening, being an active listener, being a thoughtful collaborator, building trust, making a commitment to work with your partners, being okay with dissent, right? And learning how to work through challenges, learning how to work through feedback that doesn't feel the best or that could be looked at as negative, and being adaptable and flexible to change. So when we talk about engagement in obstetric care, Lindsay and I wanted to spend a bit of time really giving you some details about what we mean and some examples of what we actually mean by the types of engagement that you can have in obstetric care. So the first part that I'll talk about is patient engagement. And so these are things like surveys to patients, advisory councils, co-leading quality improvements, focus groups, with patients who've had similar experiences to understand opportunities for improvement. It could also mean working with a community partner to really understand, especially community partners who have direct access to patients of yours. So these could be social services providers, to really work with that community partner to have access to more of your patients who you just don't normally find in the clinical setting, to understand those preferences and to get more ideas and identify more opportunities on places to improve.
Thank you, Kendra. Thank you for that insightful overview on defining patient and community engagement and the principles and strategic ways to improve patient care. And so, as we've seen or heard, engaging patients effectively is essential for improving individual health outcomes and ensuring that patients are actively involved in their own care. However, to truly enhance obstetric care, it's crucial to also extend our focus beyond individual patient interactions to that broader community. And so community engagement builds on the principles of patient engagement by creating that supportive network that addresses collective health needs and fosters an environment where both individuals and groups can thrive. And so there are many benefits to community engagement. And so we see here, nonprofit hospitals in California are exempt from paying federal and state taxes if they meet certain standards, including an obligation to finance a set of community-focused charitable activities known as community benefit. And according to a 2024 report from the California Healthcare Foundation, U.S. hospitals reported over $93 billion in community benefit spending in 2020, of which $8.7 billion was attributed to hospitals in California. And so collaborative engagement is essential to improve and deliver equitable care. And some examples are to participate in a network to coordinate the continuum of perinatal care, to join a learning collaborative with mixed participation from clinical teams, from social services and community, and really to work with community and their unique needs that need to be addressed. And so collaborative efforts are crucial when working with communities with unique needs. So when organizations and agencies and individuals come together, they can pool their expertise, their resources, and perspectives to really develop more effective and culturally sensitive solutions. And some key points to consider are inclusivity, building trust, leveraging diverse expertise, creating sustainable solutions, and having that shared responsibility. And so in summary here, effective collaboration can transform challenges into opportunities by harnessing that collective, the strengths and insights of all involved. Next slide, please. So here is an example of community engagement in the low-dose aspirin initiative that I am leading here at CMQCC with my clinical lead in collaboration with the March of Dimes. And so I am a public health person, and I love conceptual models. So this is a community-centered approach to promoting low-dose aspirin adherence using a methodological approach to center and engage community. And as you see here, the population is made up of a bunch of different groups, right? So we have providers, communities, pharmacists, nurses, doulas, midwives, and other birth workers. And within the interventions, we have education, where we have our patient education materials. We have posters. We also have videos that show the patient-provider interaction in terms of discussing risk respectfully. We also use social media, where we have our patient education materials, and we promote the webinars that we do. And in terms of outreach, we're really getting out there into community. We attend community events. We attend health fairs, and we talk about this LDA work at conferences. And there's also a data piece where, you have the hospital data, the clinic data, and then also provider and patient surveys. And with all of this together, it can lead to establishing guidelines for community-centered promotion of low-dose aspirin, which can then lead to scaling up and scaling out of this intervention. Next slide, please. So here we show community-based QI implementation and roles of influencers for the LDA initiative. And so ensuring adherence to low-dose aspirin, particularly for conditions like preeclampsia prevention in pregnant and birthing individuals, requires a multifaceted approach. So healthcare providers, social media, family members, churches, WIC, Black Infant Health, Healthy Start, and I know I'm missing a few, all play a crucial role ensuring adherence to low-dose aspirin. And so we know providers can educate patients about the importance of taking low-dose aspirin as prescribed. They can monitor their progress and address any concerns. But everyone that you see here can provide ongoing support to promote adherence throughout the pregnancy. And additionally, pharmacists can also play a crucial role in counseling patients on proper use. So by leveraging the strengths of healthcare providers, birth workers, social media, community-based organizations, family members, and religious organizations, we can create that comprehensive support network that enhances adherence to low-dose aspirin and promotes that overall health and well-being. And I know many of you have heard this before, but it truly takes a village. Next slide, please. And so, attending community health events is really, really important for a number of reasons. So, there's education and awareness, access to resources, which can be especially beneficial for those who might not otherwise have that access. Building those relationships with healthcare professionals, local organizations, and other community members, which can help foster a supportive network and improve community health overall. Promoting wellness and advocacy and support, advocating for changes in local health policies, reducing those health disparities. And so these events often aim to reach those underserved populations, helping to reduce health disparities by providing those essential services and that information to those who need them the most. And then lastly, community engagement. Engaging with these events fosters that sense of community and collective responsibility for health. And so it encourages people to take an active role in improving their own health and the health of their community. So here are just some pictures of myself and my colleague at a few AIM events, and AIM stands for African American Infant and Maternal Mortality Prevention. We're at a birth worker career fair, where we're talking about low-dose aspirin and Medi-Cal. And then to the right, there's a baby shower / community resource fair where we're talking to a lot of birthing people about what is preeclampsia, what is low-dose aspirin, talk to your healthcare provider. And so being present at community events and health fairs is a strategic way to connect with that community, to promote these health services, and to really gather feedback and support overall public health. And it helps to build trust, enhance health education, and provide valuable resources directly to those who need them. Next slide, please. So with the LDA initiative, we also have a webinar series, and we uplift patient voices in this work. And so webinars and patient stories play really important roles and are so powerful, and they're powerful tools for community engagement. They enhance education, they facilitate communication, and they foster a sense of connection and empowerment, ultimately contributing to more informed and supportive communities. And so here I'm just showing two of our webinars that we've had. One was on how can pharmacists help in these efforts. Another one that we just had with myself and my clinical lead is how community engagement enhances clinical care. And so clinic and community partnerships are crucial in addressing and preventing maternal and infant mortality. And these partnerships leverage resources, knowledge, and community connections to improve health outcomes. And so by working together, hospitals, clinics, and community organizations can create a more comprehensive and supportive network that addresses the multifaceted challenges that contribute to maternal and infant mortality. And the collaborative approach is essential for achieving meaningful and sustainable improvements in health outcomes. So connecting providers and birth workers with clinic and community spaces involves creating that network that can help facilitate collaboration, communication, and mutual support. And by fostering these connections in clinic and community settings, you can really enhance the quality and continuity of care, address health disparities, and improve overall maternal and infant health outcomes. Next slide, please. So the Kansas Birth Equity Network is a consortium of interested people around Black maternal health in Kansas. And so they bring together parents, community members, community organizations, birth workers, physicians, and more to increase awareness of the Black maternal health crisis, to understand the impact of racial discrimination and chronic stress on maternal and infant outcomes, and to develop solutions to improve the health of Black families. And so we know racial discrimination can have a profound and detrimental effect on maternal and infant outcomes. And so in order to address this issue, we need initiatives like the Kansas Birth Equity Network to help develop solutions and efforts to mitigate the impact of racial discrimination on maternal and infant outcomes. And these efforts can help improve access to quality care, culturally competent care, community support, and policy change. Next slide, please. So you really want to establish strong community connections. And cultivating collaborative relationships across groups with mutual interests can help spur future collaboration. And so here are some examples of things to become involved in once you know what's going on in your local communities. And you really want to make connections and build trust. So you can attend community-hosted events, maybe host topic-specific meetings, promote and sponsor community-hosted events. And as you can see here, these are some events that the Black Mamas Matter Alliance hosts for Black Maternal Health Week, which is always in April. You want to share information at public events. Celebrate cultural heritage, and this can help embrace diversity, it can foster understanding, and it can build a collective sense of identity and pride. Maybe history months. And then lastly, engage people in the languages that they use. And engaging people in the languages that they use promotes equity, because this ensures that language barriers do not prevent people from accessing information or participating in community activities, and helps promote equity and fairness. And engaging people in the languages that they use is essential for creating an inclusive, effective, and supportive community. And it helps to ensure that everyone can participate. They can all feel valued, and access and resources and opportunities are available to them. Next slide, please. So oftentimes engaging the community is not mandatory. It's not an institutional priority. And so here are some of the common challenges of community engagement that we know exist. Might be a lack of awareness, not enough time or resources. So for like budget, for example, community engagement initiatives often require financial resources for activities like outreach programs, educational workshops, and partnership building efforts. And without that funding, it can be hard to sustain long-term initiatives. For team members, engaging with the community effectively typically requires a dedicated team to plan, to execute, and manage engagement activities. And in many cases, healthcare organizations may have a small staff or limited personnel available for these tasks. And so a lack of sufficient team members can lead to overburdened staff, burnout, and reduced quality of engagement efforts, and missed opportunities to really connect with and support the community. And for expertise, effective community engagement requires specialized skills and knowledge. It's not easy, like cultural competency, communication strategies, and partnership development. And without the right expertise, engagement efforts may fall short in understanding those community needs, in building that trust, and designing effective programs that really resonate with diverse populations. As I mentioned, you need to build trust. So there's trust issues, maybe not enough training in how to really equitably engage with other community partners. There might be a resistance to change, not valuing community and patient voice. And then lastly, problems with measurement and evaluation. And so when community engagement in obstetric care is not an institutional priority, addressing the challenges requires a very strategic approach that involves advocacy, collaboration, and innovative solutions. And so building strong community partnerships, demonstrating the benefits of engagement, and creatively addressing barriers and challenges can help advance the goal of better obstetric care through enhanced community involvement.
Thank you, Lindsay. Very helpful. So in the last portion, or the last two sections of our talk, we want to spend some time with you to discuss briefly opportunities for identifying obstetric, community obstetric services, and as well as actual strategies that you can employ to really manage some of these some of those challenges that Lindsay mentioned, and either get started or strengthen what you're already doing. So identifying community obstetric services, oftentimes hospital teams just say, like, I don't know where to start, I don't know where to go. And the brief answer, but the most important answer, is you just got to get out there and look. And getting out there and looking really requires Googling stuff, and that goes back to knowing what you're interested in, knowing what populations you're interested in, what issue you want to address. Knowing those things can help focus your search. Talking to community partners that you likely know more people than you think you do when it comes to community involvement. And so you really just have to tap into your community partners and start snowballing contacts. Okay, start asking people and adding more contacts as you go. You can also talk to patients. So asking patients, where are you getting your prenatal care if they're not getting it with you? Where are you getting your nutrition education? Where are you getting your nutrition information? How are you, managing your health and well-being? Like, what are you thinking about? Where do you go? And the answers might surprise you. And so it's really helpful to ask patients, and it's a brief thing that you can do at the end of a visit, or at the beginning of a visit, or whenever during a visit, to understand what's actually happening in your community, is who are people who are touching your patients, right? Also accessing community needs assessments. Lindsay talked earlier about community benefits. So your hospital or clinic, but more really your hospital, will likely have a community benefits group who sponsors a community needs assessment every 3 or 5 years. As well as your locality will likely have a community needs assessment. And so you could be tapping into those to identify partners, to identify people who are working in the maternal health space, because there most of the time are sections around maternal health and reproductive health in those community needs assessments. Conversations with other local health providers. So speaking to your colleagues, nonprofits in the area, social services providers, and also people who provide medical services. So basically, when you have an issue or an area that you want to work in, you need to just start asking people. Who do you know? Who's working with this group? How are they working with this group? And then make it your business to reach out to those groups, to start dialogue, to start a conversation, and understand that even if you're not quite ready to, initiate a partnership for your unit or for your hospital, right? Because that's a commitment. Even if you're not ready to initiate a partnership, you can initiate a relationship. Okay. And it can be, let's meet on Zoom for 20 minutes just to connect. I want to know more about you, and I can share with you some of the things that, are happening on our unit, and you've now started a relationship with people. So it can start very small. And I want to encourage you to think that way as well. So when we talk, we want to talk about practical strategies for enhancing engagement. So before I get into this, I want to say, like, we understand that engagement is challenging and it's not necessarily probably what you went to school for or what you went into medicine for, but it's important, and it's important, it's doable, and it's something that you can start small with, and grow to become whatever it is that your organization wishes and hopes for. But you can start very small, and it's feasible for just about anybody. Because at the core of what we're talking about when we're talking about engagement, we're talking about relationships. So it's just building relationships, and we have time to do it, and we can make time to build these relationships. So CMQCC, if you're a California hospital, a member hospital to CMQCC, we have a hospital action guide. It's called a Hospital Action Guide for Respectful and Equity-Centered Obstetric Care. And in this Hospital Action Guide, which you can find in the account section of your CMQCC account, we have a whole module dedicated to community partnership and community partnership development. And it's the 6th module in our hospital action guide. And so I'll be referencing it through the rest of this section. So please know that's what I'm talking about if I ever reference the hospital action guide. So the first portion of the first thing to consider when we're talking about developing your engagement strategies is really determining your goal for patient or community engagement. Right. So without knowing your goal, your engagement is just kind of it is unfocused. And it will be challenging for you to do if you don't know your goal, if you don't know who your target population is, if you don't know what you actually want to accomplish. So here are some opportunities for goal identification. One of the first areas that you can And one of the first ways that you can identify your goal is by reviewing hospital data. So, of course, if you're a California hospital, CMQCC provides data through the Maternal Data Center about your hospitals, how you're performing, and that can give you ideas on things that are going well for your hospital that you might want to capitalize on, or things that can be improved upon that community and patient engagement can also be supportive in. And so you can go to the CMQCC accounts area. And if you're not a California hospital, you can also check with your state PQC to see what data they have available to help ground your goal identification and see where there are areas where people in your community or in your region might need more support. The other way is to identify opportunities based on observations from staff in a unit. So people in your unit are working in the community, right? They're working with members of the community as patients. And so people on your staff can tell you what they're seeing, if they're seeing trends amongst patients, if patients are kind of saying the same things or they're having the same issues. Those are valuable insights that you can take in. So, in a different state, report that I was reading on maternal health, this state was saying that there were a lot of incidents of substance use disorder and difficulty managing that in the hospital, right? Like this could be an area for goal identification on where there are opportunities to train your staff to work with other service providers who are working with that population to figure out how to better serve people with substance use disorder when they do come to the hospital to deliver or to seek care, right? So these are opportunities, right, to identify goals. Another way is by talking to other social services providers and community partners. They can tell you what they're seeing, what patterns they're experiencing with the people who they are serving. So those are also ways in people to help identify potential areas for you to address. And then really more internally, you can also look to your patient reported experiences surveys to understand what patients are saying and what they're experiencing in their care. And I think if you do some combination of these four, that it's a really good way of focusing your efforts and identifying a goal that really makes sense for your group. So another strategy for enhancing engagement after you identify your goal is also understanding what's happening at your facility. Right. So there can be hospital level engagement. There could be unit level engagement that are happening in your hospital. There can also be your community benefits departments. They could be giving grants to social services providers or other nonprofits or other medical services. And these are all things that are important for you to know. One, because you can tap into these things. Right. It's always easier if you don't have to reinvent the wheel. And so tapping into what's already happening at your organization and within your community is really important. And so asking around is certainly part of that. In addition to that, you can also identify existing advisory boards, existing working relationships, working groups and hospital relationships with other providers, policies that you may have, that your organization might have that might be supportive of your work, and case studies from other hospitals. You can also look at local data like local reports from community needs assessment, which I already mentioned, public health data that's freely available. And then identify assets and relationships that need to be developed. So once you've identified your goal and you've checked within your organization about what already exists and what you can already tap into, then you can make educated decisions about what types of relationships and what types of assets that you need to move towards your goal and to actually make your goal happen. And so over to my right, I have a worksheet. So Medicaid Innovation developed this really helpful toolkit, and it's like a writable or fillable PDF. So you can actually go in and type in it to identify like all these aspects of community partnerships, community partnership and community engagement. And so this page actually gives you a fillable form for you to identify organizations that you could work with, and to put that in their information, their organization, all that in one place. You can also identify people who know them. So that goes back to identifying people who already know what's going on or might have something going on. So you can say, our vice president of community benefits knows these people and can help spark a relationship or create an introduction between us and these people. So you can use this worksheet and workbook for that purpose. And so if you are a California member hospital to CMQCC, you can find this in the hospital action guide. But if you're not, that's fine too. We have the link, and Savannah will drop that in the chat for the Medicaid Innovation Value of Investing in Social Determinants of Health Toolkit. And these are the pages that you can access these. I encourage you to look at all of them, but if you're tight on time, pages 13 through 14 and 20 are helpful in starting this work. After you've identified your goal, you've checked around your facility to see what's already happening, and identified what assets you'll need to develop to do this work, then you can start developing your strategic plan, your preliminary strategic plan around doing this work. And so in order to do that, you need to really define your objectives, your goals, and your outcomes, with the knowledge that they will likely change over time, especially as you gain partners, right? They should change because they should also include what the partners need and want to happen, because that's what makes it a mutually beneficial partnership. And so preliminarily, you can be identifying the objectives and goals and outcomes. So let's say, for instance, you want to address nutrition because you've noticed that anemia is a problem in that you've seen in the community or in your unit. lately, then you can develop goals related to addressing nutrition, addressing iron deficiency in the local community, and working with service providers to do so. You can also identify a target population. Is your population all birthing people? Is it people who are iron deficient, people diagnosed with iron deficient anemia? Is it people who are of a certain BMI? Is it for people who are, who've had a low birth weight baby and who are pregnant again? Like, who are you talking about, right? And who would you best like to support in your community partnership work? And so that is part of your strategic plan. Also, in the same workbook that I just mentioned, there are a few worksheet pages that you can go in and start addressing things related to your purpose, your vision, and your objectives and your goals for your community partnership. And this is also really nice and helpful once you start building relationships with your community partner to bring this to the table and say, this is what I've developed preliminarily. Like, what do you think, and what goals or outcomes would you modify or shift, or do you think you could support, or we could do together, right, to make the kind of impact that we want to have. And so this is also available to you in the same toolkit. You also want to, once you've done your preliminary strategic framework, you can also go to tap into your resources, and that includes going to your leadership to discuss the strategic framework, to understand if this is aligned with the organization's principles, with the organization's philosophy. And then you can begin in earnest to build or strengthen your community relationships. And so when we say build or strengthen your community relationships, we're also saying that it's on your timeline. So if you have a busy schedule and this is something that you're doing because it's a passion of yours, and you know that it's needed in the community, you can frame out your timeline for this. And a lot of times partnerships just start with simple conversations to see if you align on the same things, if you and a potential partner are interested in the same things, and ultimately can partner to achieve something together, right? And so you can take your time in doing so, and there's no requirements on how fast or slow that you need to do that. Additionally, I talked earlier about making sure that equity was at the center of your engagement. So here's the important part about making sure that you have equitable engagement with your partner. You need to be a flexible partner. You need to be a thoughtful partner and an active listener. So most of the time, hospitals, clinics are big anchor institutions in communities. And with that comes a certain level of prestige or clout and power that you have as an agent of your organization. And so you need to recognize that. And you need to recognize how that can play a role in how community groups, especially smaller ones, engage with you, and be sure that when you're developing these partnerships, that they're not one-sided, that they're mutually beneficial, and that what you're taking, you're also giving in a way that is useful and meaningful to your community partner, right? So those are things to keep in mind. And you also need to work collaboratively on your strategy with your community partner. So a few slides ago, I said that was your preliminary strategic plan. And then once you have your partners in place, then you develop your actual strategic plan that you will put in place. And there are two nice worksheets in a different toolkit that we'll also add in the chat, the playbook for fostering hospital community partnerships to build a culture of health. Those also are helpful worksheets for you to use to do that and to work with your community partner. And then you start work following your plan strategy. And the important things to remember about starting work on your plan strategy is always remaining collaborative, and to be thoughtful partners, and to ask for feedback as well as provide feedback. There are, as in anything, as in any relationship, things happen, right? And so you want to make sure that you're talking to your partners and that you are, and that they're talking to you, and that where there are opportunities to improve your partnerships, that you have an open enough and trusting enough relationship for you to do that with your community partner.
Okay, so to close this out, this is one of my favorite depictions, on the importance of community, centering community and engaging community, because communities really are the next frontier, and they're just so, so important. They're the next frontier in healthcare due to their critical role in improving health outcomes, driving health equity, and it transforming healthcare systems. Communities represent a crucial frontier in healthcare because they offer a very, very unique vantage point for addressing health challenges, promoting equity, and fostering more effective and personalized care. So by focusing on patient and community-driven approaches, the healthcare system can become more responsive, more inclusive, and more sustainable. Next slide, please. So our mission at CMQCC is to end preventable morbidity, mortality, and racial disparities in maternity care. We create tools, including scripts and education materials, and improve outcomes through data-driven quality improvement. So we all must listen with our hearts and minds and remember that the more different someone or a community is from us, the harder we need to listen. Next slide, please. So thank you so much for taking the time to join us today. Please check out our toolkits, follow us on Facebook, Instagram, Twitter, and LinkedIn. Thank you.
Thank you so much, Dr. Smith. Thank you so much, Dr. Duplessis. This was a wonderful conversation. We do have a little bit of time for questions, so I do have a question for each of you to answer from our Q&A. First, for Dr. Smith, we have a question about how do we go about impacting changes at the federal level and advocating for gaps that we see in care for maternal health? And to follow with that, do you have any models for supporting this kind of care at the organizational level? If we want to aim for that federal level care, how do we even start with the organizations that we're a part of?
Yeah, so that's an important yet tricky question. So, if you want to advocate as an organization, that's one thing. But the question sounds like it might be also just as a professional, just as a professional advocating. And my best advice is to identify groups, organizations who are doing that already. Chances are, just how things are, there's really not a lot new that people aren't doing. So I would first look for people or look for groups who are advocating in that space and see if your values align with their path. Because we can all have the same goal, right? But the path to that goal could be very different. So seeing where there's alignment between you and those people and those organizations, I think is really a critical first step. And if it's advocacy or just contributing to the conversation as an organization, I mean, that's such a, you can lead from the bottom up, but it's also really important to have leadership at the table and in helping to frame that conversation. Savannah, there was a second part about models below.
Yeah, can you talk about any models for demonstrating success to advocate for the support of this work at the organizational level?
Yeah, so the answer about models is no, but I have tips. So when we talk about models for measuring success, it's always a challenge with patient and community engagement because it is ongoing. Right. So if you're doing it right, it is long-term, it's sustainable, but those are also things that you should be measuring. So you should be measuring what your community partners think about and how they feel, how they feel the partnership is going. You should also be measuring patient outcomes, right? So if you're doing something that should directly impact your patient population, that should be factored into your measures. You should also be looking at patient quality, like patient experiences. So those things are all involved can also be measured. In terms of models, it's been very challenging in the patient engagement space to have one model because every partnership is so unique. And I know there's a public health model, Lindsay, remind me, that is slipping my mind, that is helpful in this. If you leave your email, I'll send it to you. I just can't think. It's a public health model. We use it all the time. It's I know that's not helpful, but anyway, go to the next question. I'll try to think about it. What's the name?
No, that's really helpful, and we'll keep some resources coming in the chat for you guys if we can. Lindsay, in the last minute, I have a question for you specific to the work that you're doing for low dose aspirin adherence. We have a question about how can childbirth and perinatal educators be a part of that work and come alongside. This question was specifically about the expertise of Lamaze childbirth educators and how do they get involved in the community engagement.
I mean, that's wonderful. I would email me, I can get my email to you. But I think, yes, Kendra, but I think, really involving birth workers is essential to this work because they often serve as a safe space for these women and birthing people during and after their pregnancy journey. And so I think it's also important to have clinic champions, community champions at the table, and really kind of have these collaborative efforts to come together and kind of bounce ideas off of each other. So as I mentioned before, I did see that question, but I can provide my email address to them as well to see how they can be involved. I would welcome that. Thank you.
Wonderful. Well, that wraps up our webinar for today. Now that we're at 1 o'clock, thank you everyone so much for joining us. Thank you, Dr. Smith and Dr. Duplessis, for your wonderful insight and your strategies for community engagement. Keep your tabs open for what's going on at CMQCC webinars and events in the future, and keep an eye on your inbox for those of you who are looking for that evaluation. We would welcome any feedback and any ideas for the future. Thank you so much for joining us, and have a wonderful afternoon, everyone.
Thank you.